يعني
بالانجليزي.
بيجي لنا هاني كل قد ايه يعني؟ لازم
حبيبي.
نسجل لك كل حاجه. طمني عليك يا هاني، انت وحشني والله.
حبيبي والله انت اكتر والله، شكرا جزيلا.
بس قبل ما تبتدي بعد اذنك، لو بدات اليوتيوب قولي لي يا دكتوره زهره بقى.
فتحنا يا فندم، اتفضل.
طيب دكتور هاني، آه الحقيقه انا يعني اتشرف ان انا اعرفكم بصديقي العزيز الاستاذ الدكتور هاني القاضي، استاذ الجراحه وجراحه الطوارئ في مستشفى الجامعي، مستشفى قابوس الجامعي. وهو واحد من علامات الجراحه في عمان. وانا يعني اتشرفت بمعرفته ومرافقته في المؤتمرات، وحضرنا مع بعض مؤتمرات كتير جدا، وكان ضيفنا في مؤتمر الجراحه في المنصوره قبل كده من حوالي 6 سنين تقريبا يا هاني، تقريبا مش كده؟ 2019، مايو 2019.
سنتين بس، سنتين بس عشان ما نكبرش نفسنا يعني.
الحقيقه الدكتور هاني بيمتاز ان هو عنده خبرات كبيره جدا في جراحه الطوارئ بالذات، وله طريقه يعني يعني راقيه جدا في تقديم والعرض البرزنتيشن، سواء العلمي او الفقهي كمان. والنهارده هو هيقدم لنا تجربه فريده جدا عن الوور سيرجري، سبيشال ان غزه، لان هو خاض التجربه في غزه. فهينقل لنا اكسبيرينس الحقيقه كلنا محتاجينها، لان الحقيقه انا دخلت غزه بس دخلتها بطريقه غير قانونيه، لان كان ممنوع الدخول، ممنوع دخول غزه خالص، وكان الامور مقفوله سياسيا وبوليتيكال يعني. لما دخلنا من غير يعني من غير اثبات، عشان الموقف القانوني والموقف الدولي. لكن هاني القاضي قدر يدخل ويشتغل كمان، وانا كل اللي قدرت اوصل له خان يونس. انا مش عارف هو عدى اكتر من كده ولا لا، لان انا بعد خان يونس اضطريت ارجع. آه، خاصه واحنا بنحاول ندخل المساعدات يا هاني في الاول، كان الدنيا مقفوله
صحيح.
خالص. واول ما المعبر اتفتح قدرنا ندخل المساعدات في الاول، وكنت عايز اطمن ان المساعدات توصل لهم فعلا، لان كان بيوصل لنا كتير ان ممكن المساعدات ما توصلش ليهم هناك، تتسرق في الطريق، تتضرب، بيحصل مشاكل. فاحنا فيري انترستد ان احنا نسمعك النهارده يا دكتور هاني، وتقول لنا تجربتك عن الاكسبيرينس بتاعتك في غزه، اكسبيرينس والاكسبيرينس ان وور زون. اتفضل يا دكتور هاني بيه.
شكرا شكرا دكتور، شكرا جزيلا على الاستضافه، وتحياتي لكل العاملين بجامعه اسوان، وكل الاطباء والحاضرين للبرزنتيشن. The presentation is going to be in English. If you have any questions, you can in the chat, uh, or stop me, just open the mic and ask me. I have no problem at all. So the start of my mission, it started basically with this webinar. My colleague, Osama Hamid, who is a Jordanian surgeon, went to Gaza in February, and he spent a month in Gaza. So he, after he came, he wanted to share the experience of what he saw in Gaza. Um, and so he had a webinar, international webinar, and for some reason, subhanallah, يعني اختارني أنا, he chose me out of a lot of, he has friends all over the world, mashallah عليه, Osama. He chose me and Dr. Qali from the States, United States, to moderate this webinar. So he showed us all the cases that he, and all the difficulties that he faced in Gaza. So I was like, I'm a trauma surgeon. I should be there. Why am I not there? كمان I believe also in the Palestinian struggle. فقلت له أسامة, يعني at the end of the webinar, I said, how can I go to Gaza? I want to go to Gaza. Please hook me up. يعني, how can I go? So he was like, are you sure you want to go? I said, yeah, I'm sure I want to go. I'm a trauma surgeon. I should be there in Gaza. So he hooked me up and I went. I'll tell you how later on. So just a few words about Gaza for those who don't know. Gaza basically is a strip of land in Palestine, who stretches 40 kilometers long and 12 kilometers across. In this small strip of land, 2 million people are living. Gaza is divided into Shamal Gaza or North Gaza, Middle Gaza, and South Gaza. So North Gaza is called Gaza City أو مدينة غزة. Middle Gaza is Deir al-Balah. And South Gaza is Khan Yunis and Rafah. After October 7th, what happened is the Israeli army attacked the north of Gaza and asked the people to evacuate the north and go to the south. Whoever has left the north and went to the south could not come back because they put a barrier, Hajiz, Netzarim, or the barrier of Netzarim between the north and the south. And those who stayed in the north stayed in the north. They were not allowed to leave at all. And those who left are not allowed to go back. Nothing is allowed to go back between the north of Gaza and the south of Gaza. So nothing goes into the north of Gaza. South of Gaza used to get a lot of help through Egypt, عن طريق رفح, through Rafah crossing. But the north of Gaza, nothing. No food, no equipment, no nothing. So 40 kilometers by 12 kilometers, 2 million people. By the time when I went, so this was in June, الإحصائيات says there's 40,000 people who were martyred, shuhada, and over 94 people who were injured. 94,000 people who were injured. So 40,000 people murdered or killed, martyred, and over 94,000 injured. This is in June when I went, okay? The number now is much, much higher. Since October 7th until June when I went, there was about 443 attacks on healthcare facilities. 31 hospitals were destroyed. This is the official statistics, okay? 31 hospitals destroyed, 8 hospitals only were functioning. 4 of them were in the south and 4 of them were in the north. So in the south, Shuhada Al-Aqsa, the European Hospital, American Field Hospital, and Nasser Hospital. In the north, Al-Ahli Al-Ma'madani Public Aid Hospital أو الخدمة العامة, Kamal Adwan, and the Indonesian, مستشفى الإندونيسي في الشمال. So I highlighted the ones that I worked in. So I worked in the Shuhada Al-Aqsa in the south and Public Aid Hospital in the north. So initially, when my friend Osama contacted جمعية العون الأردنية or Jordan Health Aid Society, who is a partner of Project Hope. Project Hope works with the United Nations to help medical staff to go into Gaza. So Project Hope contacted me and they said, there is a mission to Gaza through Rafah. So we'll go to Egypt and then enter through Rafah. And the mission is to the south of Gaza, جنوب غزة, مستشفى شهداء الأقصى في الجنوب. So I agreed. But what happened is the Israeli army attacked Rafah and blocked the entrance to Gaza from Rafah. So it was not possible to go through Rafah anymore. Then they called me again. They said, the only way that we can go is we go through Jordan and then we enter Palestine, occupied Palestine, and then through الضفة الغربية, West Bank, and then through Jerusalem, and then we enter into Gaza, in the south of Gaza. And the mission was again to Shuhada Al-Aqsa in the south. So I said, okay, I agree. They said, you agree to go through Israeli army checkpoints? I said, yes, I agree. So then they called me again and they were like, okay, now the United Nations wants to take a medical team to go to the north of Gaza. Do you agree to be? Because nobody else, no other organization has agreed to go to the north of Gaza because it was very dangerous to go to the north. And I was like, what is the problem with the north? They said, oh, there is no food, there is famine, there's a lot of bombing, a lot of destruction, more destruction in the north than in the south. I said, it doesn't matter. I'm going to Gaza anyways, whether it's the north or the south, I'm just gonna go. So yes, so that is the final mission, was to go through Jordan and to go to the north of Gaza, not the south of Gaza. So this is us. This is the team that we went. So this is on June 4th initially. So the team consisted of 2 nurses. So this is Abu Muhannad, who is, mashallah alayhi, 64-year-old operating room nurse. This is Sami, and also an operating room nurse.
دكتور هاني
أيوة.
معلش النت كان قطع، ممكن نرجع لورا بس للسلايد اللي كنت بتشرح فيها كم اتاك في غزه. ايوه هي دي
هنا. ايوه اوكي تمام.
ايوه اوكي.
ابدا.
اتفضل يا هاني اتفضل.
Okay. So since October 7th, there was 443 attacks on healthcare facilities. 31 hospitals were destroyed, both in the north and the south. Only 8 hospitals were functioning when I went. There was only 8 hospitals, to my knowledge, were functioning. In the south, there was 4 hospitals: Hany Al Qady, European Hospital, American Field Hospital, and Nasser Hospital. And in the north, Al-Ahli Al-Ma'madani Hospital, Public Aid Hospital, Kamal Adwan Hospital, and Indonesian Hospital. The ones that I highlighted in red are the hospitals that I actually worked in. So in the south, it was Hany Al Qady, and in the north, it was Public Aid Hospital. So my colleague Osama connected me to Jam'iyyat Al-Aun Al-Urduniya, or Jordan Health Aid Society, who work with Project Hope, which is an organization that works with the United Nations to deliver, to facilitate access to healthcare workers, doctors, and nurses to go to Gaza. So Project Hope contacted me initially and said the first mission in May is to go through Rafah. So we go to Egypt, cross Rafah, and we go to Shuhada Al-Aqsa Hospital in the south. So I accepted it. Then the Israeli army attacked Rafah and stopped people crossing from Egypt to Gaza. So Rafah was not an option anymore. So then they called me and they said the other option is to go through Jordan and enter through the occupied Palestine, West Bank, Jerusalem, and then enter Gaza from the south. And then the mission was to Shuhada Al-Aqsa Hospital also in the south. So I accepted, and they said, "Are you okay going through the Israeli checkpoints?" I said, "Yes, I'm okay, there's no problem." And then the third mission, they called me again and they said, "Listen, you know, the United Nations wants to send a team of doctors to the north. Would you be agreeable to go to the north?" موافق تروح الشمال? And I was like, "What's the difference between the north?" And I didn't know the difference between north and south وكده. But they told me the north is worse. The north has a lot of bombings, في مجاعة, no food and no water, and more destruction in the north than in the south. So I said, you know what? I'm going to Gaza anyways, north or south, it doesn't matter. I'll go to the north. I don't mind. So that was the final mission. We go through Jordan, through West Bank, through Jerusalem, and into the south of Gaza, and then later on we go to the north of Gaza. So this is our picture when we entered the bus. 2 nurses, Mr. Muhammad Hamad, or Abu Muhannad. He is, mashallah alayh, 64-year-old operating room nurse. This is his second time to go to Gaza. Sami Abu Farhat, he is an operating room nurse as well. Dr. Zahir Mashraqi, he is an anesthetist. And Dr. Osama Hamid, my colleague, and a surgeon. So the team consisted of 2 surgeons, 1 anesthetist, and 2 nurses, 2 operating room nurses. The idea is when we go to the north, we have to be a self-sufficient team. We don't want any help from the Palestinian colleagues. We are going there to relieve them, نريحهم. مش رايحين نزود عليهم شغل. So we're not going there to add work to them. So if you just send surgeons, then we will need an anesthetist and we will need nurses. So they send the surgeons, 2 surgeons, 1 anesthetist, and 2 nurses. This is our picture when we entered, and this is our picture when we left. And you can see the difference in weight, and we lost quite a bit of weight 5 weeks later. So just to show you, this is the way. So this is Amman, Jordan. We cross into the West Bank through Jerusalem, and we go down to south of Gaza. And later, we go from the south of Gaza to north of Gaza through the Netzarim crossing barrier. Usually this trip takes about 3 hours. Took us about 17 hours to reach there. And from the south to the north, usually takes about 40 minutes. Took us about 9 hours to go from the south to the north. So when we talk south to north, you think it's a huge distance. It's only 40 minutes by car. So we entered Gaza through Karm Abu Salim, Al-Ma'bar, Karm Abu Salim. The moment you enter Gaza, you have to change. You have to wear bulletproof vests, bulletproof helmets, and go into bulletproof cars because it's a war zone. This is our picture going in, and this is Khan Yunis, Dr. Ibrahim. This is how Khan Yunis looked from the car: destroyed buildings, destroyed mosques. Everything is destroyed. People are homeless in the street. So it was a bit of a shock to see this as soon as you entered Gaza. So the first stop was the guest house, أو بيت الضيافة. You go there and then you stay in the guest house until your mission is ready. So our mission was to the north, not to the south. So they asked us, do you want to stay in the guest house until you go to the north, or you want to go and work in the south, in the Shuhada Al-Aqsa hospital? So we told them احنا مش جايين هنا نرتاح يعني. We're not here to rest in the guest house. We want to work. So take us to Shuhada Al-Aqsa hospital until we get the permission to go to the north. فلغاية ما نطلع للشمال ودونا شهداء الأقصى نشتغل لغاية ما يجينا الأوكي إن احنا نطلع للشمال. And that's what happened. So we went to Shuhada Al-Aqsa hospital. This is the director of the hospital, received us. Very warm welcome. This is the hospital, and you can see in the hospital, outside this is the hospital, and outside the hospital there are tents, khiyam. That's where the doctors and the nurses are living, in these tents. Because most of these doctors have moved from the north to the south, so they have nowhere to stay. ما عندهم أي مكان يعيشوا، فيعيشوا في خيام. And this is where we stayed. طبعا, if you look at this, you think it's a bad place to stay. It's actually luxury هناك. إنك at least you have a wall. It's inside the hospital. You have a fan and you have a mattress to sleep on. The rest of the doctors and the nurses are sleeping outside in the tents. The rule is, whenever you're in a war zone, eat when you can, sleep when you can, because you never know what happens during the day. So what challenges did we face? So first of all, it was a new environment. Usually, if you're a surgeon, you're going to a new hospital, you want orientation, you want to somebody to show you around, somebody to tell you what's happening, what are your roles, what are your mission, But there is none of this. Everybody was busy. There is lack of equipment, of course, lack of beds. So patients are admitted في الكوريدور, في الساحة outside the hospital, in the open air, في الهواء, طلق, under the stairs. Because there's just not space. There's not enough space for the patients, so they're admitted everywhere. Lack of medications, of course. Electricity will always frequently cut off. So while you're operating, the electricity would cut off. So you have to continue the surgery with using the phone lights. There is lack of clean water as well. So even the water that you shower with and you brush your teeth is salty water. Infection rate was very, very high, especially in the south, not in the north, in the south. Malnourished patients, especially in the north. These patients have not tasted any food of color since October 7th. The only food they have is tahin, wheat, flour. That's the only food they have is flour. That's it. No, nothing else. No fruit, no vegetables, nothing. Just flour. So no protein whatsoever. Lack of diagnostics. So there's no CT scan available. There is a CT scan, but the access to CT scan was very difficult. No MRI, So what will happen is the patient will come with a picture of his relative or of himself on the phone, and then a piece of paper, many pieces of paper with the investigations, and then you have to come up with a diagnosis, and you have to come up with the plan of action. Frequently, we would also get mass casualties. So all of a sudden, you will get 300 people, 400 people. In Oman, when there's a bus that rolls over and you have seven people in that bus, we call it a mass casualty. In there, we talk about 500 people, 400 people coming all at once في نفس الوقت in the emergency room. Then you don't have intensive care units. So you have to operate on these patients, critical surgeries, but no intensive care units. So this is me trying to take a consent of the patient before going into the operating room. You can see the bed there. There is no wheels. ما فيش عجل على السرير. There is no wheel. You actually take the whole bed into the operating room. And this is me operating, and all of a sudden you find no electricity. So you have to continue the surgery using the lights of the phone. 2 days after I arrived in Shuhada Al-Aqsa hospital, they bombed a school called in an area called Nasirat, مذبحة النصيرات. So basically they bombed, it's a school, but it's a shelter, مأوى. And about 800 to 900 people are living in that area, and they just bombed the school. So immediately 276 people were martyred, استشهدوا, and about 700 people were injured. A lot of these 700 people came to our hospital, so about 400 to 500 people. The rest went to the other hospitals. So you can imagine the chaos that happened in the emergency room and in the operating room. And this is what we see. So there's no beds in the emergency room. So you see the patients lying on the floor. This patient came with multiple shrapnel injuries into the abdomen and the hand and the arm. And you have to evaluate the patient while the patient is on the floor. This is me and my colleagues, the nurses, who are trying to make sense of what's happening in the emergency room. For us, we're not used to this chaos. I come from a very organized trauma system, and when I go there and I see all this chaos, you try to have a system to approach the patients, but it's very difficult to have a system there. And then I found these 2 kids injured, and this guy is taking a video of them, and I was like, "Who are you?" He was like, "I'm from a certain news organization." I said, "This is not the time إنك تعمل خط صحفي يعني. Just leave the hospital, please." And I took these 2 kids, put them in one of the cubicles, and started examining them to determine their injuries. Just to show you like how sometimes the foreign media they only care about taking the shot يعني, rather than actually delivering the right message. These are some of the injured people that we saw in the emergency room. They're lying on the floor, no beds, and then you have to evaluate them, maybe do some procedures on them while they are lying on the floor. So what did we do? We had to do some resource management. So the juniors and the volunteers, so the family physicians and the medical students, the internal medicine people, we use them to go and stay in the emergency room. They can evaluate the patients in the emergency room. The registrars and the residents will be going back and forth between the emergency room and the operating room. بيروحوا بيرجعوا. They go and come and update us. While the surgeons, we are in the operating room because we're operating one case after the other, one case after the other. There's no non-stop flow of patients to the operating room. This is a picture taken by the anesthetists of us. We started at 12 noon. We started around 12 noon, ظهر. And this picture was taken 3 o'clock in the morning the next day. We continued to operate until about 9 or 8 a.m. in the morning, or I think 10 a.m. in the morning. So this is a picture of us. We just finished operating on this patient. They're getting him ready to go out. And immediately we scrubbed for the next patient, so that the next patient is coming. And you can see like how we're just sitting there waiting for the next patient. Now, this room was not actually an operating room. It was a delivery kiosk, كشك يسموه, كشك ولادة. But they converted them into an operating room. So you have to operate in a very small space and do major surgeries as well. The injuries are mainly shrapnel injuries. So this is a small shrapnel. You can see a small shrapnel goes through the abdomen and then causes a lot of damage. This case caused a bowel injury. And they come with a very small hole in the small bowel. So you really have to be very meticulous and very careful in examining the bowel. You cannot just do quick surgery. You have to be very meticulous. I mean, you have to finish quick, but you have to be very meticulous. Otherwise, you will miss these small injuries. Children, we have a lot of children that were injured in the time that we were there. This is a child that came with penetrating injury to the abdomen, girl. We operated on her. She was 2 years old. Operated on her, found that she has bowel injury, splenic injury. We fixed the bowel. We resected the spleen, and she survived, alhamdulillah. Another child came with bowel out, so explosive injury. Bowel was eviscerated outside the abdomen. So we opened his abdomen, reduced the bowel, repaired the 2 bowel injuries, and closed the defect. He did well. He survived. That's it. Another child comes with 2 shrapnel injuries to the abdomen, and you can see the shrapnel embedded in the mesentery of the small bowel. And this is the shrapnel that comes from the explosive. This is Hanan, who is so what they do there, according to the stories from the Palestinian people, is that they find the kids, they will drop colorful bombs. So the kids will think that they are toys. They will go and play with them, and then it will explode in their face. So they will come with facial burns and amputated hands and fingers. This beautiful girl, Hanan, came with the burns to the face, and also she had a avulsed nose coming out. So I didn't operate on her. The plastic surgeon there, Dr. Mahani, operated on her, and this is her 4 weeks later. She looks, mashallah, pretty again. Abu Hassan is a father of one of our nurses in the operating room. So while we're operating, you have to deal also with this. You have to deal with the injuries to relatives of your colleagues. He came with almost amputated, so severely mangled extremity on the left leg. He also had a penetrating wound to the chest and penetrating wound to the abdomen. So I did a thoracotomy on him, laparotomy, and did an amputation of the left leg, above knee amputation. He survived, alhamdulillah, and left the hospital after about a week or so. Now the problem is in Gaza is when you do the amputation, how are they going to go back? There's no rehabilitation in Gaza. So even if they go on a wheelchair, the roads are not healthy, are not soft. So whenever it's a very challenging issue for them, the rehabilitation. So I did a thoracotomy for him. He had lung injury, and we did the laparotomy, bowel injury. These cases, we see a lot of infections there. This is one case of necrotizing fasciitis of the abdomen, and also the perineum, the gluteal area. So this is operating on such a patient requires daily wash out. So I would insist on having this patient daily coming downstairs with my colleagues as well. The Palestinian colleagues, they're amazing. They work very, very hard. And we worked and washed the abdomen regularly. And same thing with the perineum. And this is him. He survived, alhamdulillah. After a while, he recovered, alhamdulillah, but required a lot of washout. So in the South, I also asked if they have medical students. I'm very passionate about student teaching. So I asked them if they have any medical students in the South. So they told me, yes, they have 2 medical schools there, Al-Azhar University and Jama al-Islamiyya, Islamic University. Both of these universities was destroyed. Both medical schools were destroyed. Not only they destroyed the medical schools, they also took the according to the Palestinian people, all the computers and the laptops. So there is no record of these students. So what happened is I asked the supervisor to ask them to come to the hospital, and then we started giving them teaching courses and give them certificates so that it will help them in their career in the future. So the people of Gaza are amazing people. They're very, very strong, very resilient. This is a tent where they converted the tent into a school. So they will have regular sessions, muhadarat, lectures, حصص for different levels of school at different times of the day. They're very, very organized, even though they're living in tents outside the hospital, but they're very, very organized, mashallah alayhim. This is just a cute boy that I saw. He's one of the sons of one of the hospital staff. He came to us, to the hospital, to pray Salat al-Jum'ah. Very cute boy. So the people of Gaza are very, very religious people. محافظين على صلاتهم. They pray all the time, on time, even though they're going through a very, very hard time, but they never miss prayer. This is Dr. Nassim, an orthopedic surgeon in Gaza. He surprised me by giving me a gift, bringing me a gift as a thank you, token of thanks, yani. And he also brought his two beautiful children to the hospital just to say hello to us. Yeah. Imagine, like, these people are living in tents, but they're so generous and they're so kind and they're so accommodating. So after 1 week in the south, we got the permission to go to the north. So we took the bus and we went from Shuhada Al-Aqsa and we went up to the north of Gaza. We were the first medical team to enter north of Gaza for a long time. Entering Gaza, I thought the south was damaged, but if you see the north, this is a video. So the damage was much, much worse in the north, much, much worse compared to the south. No, there's not a building in the north that is not being bombed. This is the hospital that we were going to be working in. It's called Public Aid Hospital, or مستشفى الخدمة العامة. It's a private hospital that was also bombed, but they rehabilitated the hospital. They rebuilt the hospital again. And they assigned it just for us, just for the general surgeon, just for the team that is coming from the United Nations. That's us. So this is our room, and you can see the window has already been damaged because of the bombing. And this is the view from our room, and you can listen to the noise. So هذه الزنانات, or the drones, 24/7 above your head. And you can hear the Apache helicopters firing. This is just one of the noises that you hear daily, every day, many times a day. And then this is this noise. So this video was taken from the room, from our room, from in the hospital. So in North Gaza, there's a lot of these bombings that we heard, like right next to the hospital. Yeah. In South Gaza, we heard them, but a bit far away from the hospital. But in the north of Gaza, you hear it right next, like in the street next to the hospital. So how did we function in the north of Gaza? So they divided the patients over two hospitals, Al-Ahli Al-Ma'madani and Al-Khidmah Al-Amma, that we were in, public aid hospital. So Al-Ahli Al-Ma'madani will take all the emergency cases. So if any emergency case, it will go to the Al-Ahli Al-Ma'madani. The CT scans and the X-rays is in Al-Ahli Al-Ma'madani, and the orthopedics cases, plastics cases, neurosurgery cases will go to Al-Ahli Al-Ma'madani. Only general surgery cases come to public aid hospital. So the idea is that when we go to the north, there was only 2 surgeons that were operating in the north since October 7th. General surgeons, 2 general surgeons only since October 7th. and we are in June, so 8 months. And these two surgeons are operating every day, day and night. There's 500,000 people in the north of Gaza, and 2 general surgeons only operating. So the idea was to go and relieve them, give them some rest. So what did we do? We spent 3 weeks in the north of Gaza. We did over 150 surgeries and saw over 1,000 consultations. The surgeries were mainly elective in the north of Gaza because there are a lot of people that needs their gallbladder taken out. They need their hernia fixed, and majority of them, they require colostomy closure. Why? Because they have colostomy because they had bowel injury. So they will need colostomy closure. So this is me doing a laparoscopic cholecystectomy. And this me trying to doing foreign body removal from one patient who had about more than 15 small glass pieces in his arm. So we had to take as many as possible. And then this is the people that get colostomies after the war. So this patient comes, they have no colostomy bags. So they can't live with a colostomy without colostomy bags. There's no supply in the north. And they also come with colostomy complications. So these people cannot live like that. They need somebody to operate on them. Unfortunately, the surgeons up north are exhausted, and they can barely fit the emergency cases. So they don't have time to operate on the elective cases. Now, we had to do some resource management. Of course, this is a stapler that was recovered from Shifa Hospital. Shifa Hospital was the biggest hospital in North Gaza, and it was totally destroyed. So what happened, the nurses would go to the Shifa Hospital, try to get as much or as many equipment as possible and bring them to Al-Khidma Al-Amma. And this is like they found this stapler, for example. This is a circular stapler. They found it and they brought it to Al-Khidma Al-Amma. And this is a medical report, and this is how a medical report comes to you, like handwritten piece of paper, and then you have to decide. These are the 2 surgeons. These are the real heroes, actually, of Gaza, North Gaza. This is Dr. Marwan Abu Sa'da and Dr. Hazem Al-Haddad. These are the 2 surgeons that were working day and night, every day, since October 7th until we arrived. So we told them, go home, rest, ما نريد نشوفكم في المستشفى، مش عايزين نشوفكم في المستشفى، شكرا جزيلا، ارتاحوا until we leave Gaza, North Gaza. So we didn't know how long we're going to stay in North Gaza, so we told them just to go home and rest until we leave. Dr. Hazem Al-Haddad, 2 weeks after we have arrived, we heard that they have bombed his house. So 2 of his daughters were killed, استشهدوا. And he took his 3rd daughter to مستشفى الأهلي المعمداني and operated on his daughter. And then buried his 2 daughters في ساحة المستشفى. And this is him, 2 days after his 2 daughters were killed. He came to the hospital. He came to us, to the hospital, to thank us because our presence allowed him 2 weeks with his daughters before they died. يعني شكرا على انتوا لما جيتوا خليتوني سمحتوا لي ان انا اشوف بناتي لمده اسبوعين قبل ما يستشهدوا. يعني this is how these people are amazing. These are the 2 nurses في operating room in شمال غزة, يوسف قويدر and ميسرة الصافي. Yusuf and Maysara are amazing. They surprised us with gifts. تخيلوا, these people are very poor. They have no money. They have no food. Yet they have the time to go and bring us gifts. To make the story even more heart-breaking, Yusuf Qawaider, his brother, was killed the day before this picture was taken. So the day before, they bombed his brother's house. His brother, his wife, and all his children were killed. The next day, he comes to the hospital bringing us a gift, and he comes to work the next day. This is one of the heroes of Shamal Gaza, Abdurrahman Atallah. He's a nurse in the operating room. Abdurrahman was famous that when he had a shift in the hospital, he heard that his father's house was bombed. So he went and he found that his father was killed. He took his father, buried his father, دفنه, and then he came back to finish his shift in the hospital. And this is how strong these people are. Abdul Wahab Abu Warda is one of the amazing residents I worked with هناك. MashaAllah, he's very, very skilled surgeon. And there's another resident, Hilal Abdul Wahab. Hilal is wearing my scrubs. You can see him wearing my scrubs. He sent me this picture after I left Gaza. Hilal, when I left the north of Gaza, he came to my room and he gave me 2 keys, a keychain with 2 keys in them. He said, I want you to have these 2 keys. And I was like, what are these keys for? He said, the first key is for my house that was bombed. And the second key is for the operating room suite in a Shifa hospital. And I want you to have these keys. يعني تخيلوا مفتاح بيته اللي اتدمر والمفتاح الثاني لجناح الجراحة جناح العمليات في مستشفى الشفاء اللي اتدمر كذلك. And this is how amazing these people are. Now, what I noticed in North Gaza, even though they were very, very going through a very, very tough time, they never missed a shift and they never came late to work. The only person that missed the shift is Nimr. Nimr al-Shanshir is the only one who missed his shift. And the reason why he missed his shift is that they killed him. He was bombed. His house was bombed. He died along with his wife and kids. So Amr Abu Karim, Amr came and substituted for him. So he did his shift instead of Nimr because Nimr was killed. Amr, while doing his shift, his house was bombed. So he survived the killing by doing Nimr al-Shanshir's shift. Now, the patients in North Gaza, you can see how emaciated the patients compared to the south of Gaza. These people are very, very malnourished, very emaciated. They have no food whatsoever. And you can see the victims as well with shrapnels. And you can see how thin they are and how emaciated they are. We got a lot of cases with multiple injuries. This patient came with airway injury, quadriplegia, so his C-spine was injured, airway injury. He had 2 wounds in his abdomen with bowel injury. So we did a laparotomy, we fixed the bowel, closed the abdomen. We did a tracheostomy for him because he has quadriplegia. So eventually he will not be able to breathe. So he will be on a ventilator for the rest of his life. Now there's no intensive care unit. So we had to put him on a ventilator in the ward because there's no intensive care unit. We also did a lot of elective cases. This patient presented with this ugly tumor in the neck. We could not operate on him because he requires major surgery and major reconstruction, which we could not do. There's no plastic surgeon in the north of Gaza. So unfortunately, we could not do much for him. And he could not leave to go and get his cancer treated because he's not allowed to leave the north of Gaza. Again, you deal with bad circumcisions and this case of invasive breast cancer, which I had to do a total mastectomy for this lady. Of course, you get a lot of explosive injuries in addition to the elective cases. This patient came with explosive injury to the arm, and she also had explosive injury to the flank. You can see this is a shrapnel, and this is after removing the shrapnel from the flank. She survived, alhamdulillah. We also have to deal with a lot of burns because of the explosions. The worst thing is to deal with the burns in kids because every time you want to change the dressing, they're in severe pain. So you have to bring them down to the operating room and do the dressing change under general anesthesia. This is one of the cases that is very puzzling. This 70-year-old lady came with a large shrapnel injury that went through the back, through the flank, went and shattered the liver and the spleen and the bowel. So she had bowel injury, liver injury, and splenic injury. So I did a right hepatectomy on her, did a splenectomy, and did a small bowel repair. And you can see a video. of the liver injury. You see? So now you see this amount of bleeding. This lady had the injury, explosion in her house. They shifted her to Al-Ahl Al-Ma'medani. Remember, because Al-Ahl Al-Ma'medani, all the emergencies go to Al-Ahl Al-Ma'medani. Went to Al-Ahl Al-Ma'medani, they assessed her there, and then they found out that she needs general surgery. So they called us in Al-Khidma Al-Amma. They shifted her to us in Al-Khidma Al-Amma. When she arrived, I was operating on a patient in the operating room already. The resident came and told me, we have a lady who's hypotensive. I said, give her some blood and until I finish the surgery and then go assess her. So I finished the surgery. I went and assessed her. She was still hypotensive. She was about 90 systolic. So I said, no, she's hypotensive. She has to go to the operating room. We go in and we find this injury. How did she survive? I have no idea. Yani, all this bleeding, I have no idea how she survived. Alhamdulillah, after we did the surgery, we had to close the abdomen. This is the hepatectomy. And this is a shrapnel again. And she survived. Alhamdulillah, she went home 5 days later. How? Again, I don't know. This is Lisa, who was also living in one of the shelters. They bombed the shelter in the north. Her father, mother, and three siblings, Akhwan, died, killed in the attack. She was found in the street because of the explosion. She was thrown out on the street, and she was brought to the hospital. She had multiple injuries. She had a fracture in the leg. She had bowel injury, so we did a laparotomy for her. And she also had these facial injuries, through and through laceration through the cheek, and she had a tongue laceration, and she had a facial laceration. So in addition to general surgery, we had to do also plastic surgery because there's no plastic surgeon in the north of Gaza. So this is what we did. I repaired her tongue, I repaired her cheek, 2 layers, and repaired those lacerations and tried to make her as pretty as possible. And this is her before she leaves the hospital, and she looks, mashallah alayha, very pretty. This is Yasmin, who had the bowel injury or abdominal injury. And before she goes to surgery, this is what she said.
ماشي هسه مشربة مية ماشي ولا انك في وجع بطنك وجعة كثير ماشي حبيبتي يلا ولا يهمك يلا السلام عليك يا السلام عليك يلا.
She said, أعطيني نتفة ماء الله يرزقك بكيس طحين. Give me some water, may God grant you a bag of flour. This is the maximum that they can ask for in the north of Gaza, a bag of flour. She did well, by the way, and she was discharged, alhamdulillah. Dalal Al Kurd came with a very bad injury to the biliary tree and the liver. Dr. Osama, my friend, operated on her, did an amazing job and saved her life. After a while, they came to us, her family, and bought us watches to each one of us. So we're 5 members of the team. They give each one of us a watch. This is how generous these people are. In the middle of all this, they have time to come and give you a gift. Noor, I operated on Noor, and her father came and to يعيد علينا في العيد, to congratulate us in Eid. So imagine coming through a war zone, coming all the way to congratulate you and be with you during Eid and to say thank you. Yazan is another survivor of another explosion injury. So again, there are more medical students in the north of Gaza, more teaching, medical student teaching as much as possible. We did a lot of medical student teaching, and we gave them all certificates, courses as much as possible, so that they have some recognition. Now imagine these medical students, they will walk for 40 or 45 minutes in a war zone to come to the hospital to get teaching. So imagine, there's no excuse. They come on time. They come on time. They walk for 40 minutes. Girls walk for 40 minutes in a war zone, and they come to the lecture on time. This is how strong these people are. course, they before we leave, they're very appreciative, very grateful. They wrote us this beautiful piece of a letter that actually every time I read it, my heart aches. From how deep the meaning of this letter was. They also got us food from their homes, even though we have our own food. But as a gesture of kindness and generosity, they came to us and got us food made in their house. Now, how did they make donuts? I have no idea. How did they make these ajwa? I have no idea. Of course, we were appreciated as well from the university. This is Al-Azhar University in Gaza, and also the students kept on writing about us in their social media to thank us and to thank our presence with them. Also, the people from the Ministry of Health in Shamal Gaza, they came to us during Eid to spend the Eid morning with us. Instead of spending them with their family, they came, they said, because we are there, we are strangers, and we don't have our families with us. They came to the hospital and spent Eid with us. This is Dr. Fadl Naeem even tweeted about our efforts in the north, and he was very, very grateful that we went to the north of Gaza and operated on more than 150 complex operations. This is one of the beautiful patients that I operated on, and he was just so grateful. He gave me an Arabic coffee. Then we left the north of Gaza. After 3 weeks, we went down to the south, Mustashfa Shuhada Al-Aqsa again, because you cannot leave from the north. You have to go to the south and then exit from the south. And before we exited, we decided to donate blood as a sign of appreciation to the people of Gaza. And we wanted our blood to run in their veins because they are amazing people. So the lessons learned from working in a war zone, first of all, adaptability. You have to be adaptable to the situation. Sleep when you can, eat when you can. Don't demand things, like don't say, I want a bed and I want this and I want that. If there is no pillow, if there's no bed, you just do whatever with whatever you are given. Empathy and cultural sensitivity. So you have to know that these people are living in very, very harsh conditions. We're very empathetic with the patients. We're very kind to them, talk to them in a very, very kind way. Listen to them. Anytime they come, anywhere, I will see them. Anytime, anywhere, any time of the day, even in the evening. If they come to the clinic, I will go and see them in the evening. Crisis management, whenever you have a mass casualty, you have to do some kind of crisis management. Resourcefulness and innovation. So you have to come up with new, like when the electricity goes off, you don't have electropottery. So you have to come up with other ways of operating. We don't have staplers, so you have to do hands-on anastomosis, etc. Resilience and emotional strength. You deal with a lot of atrocities. بشاعة. تشوف أشياء بشعة. You see kids being targeted. You see, you live with these people. You know their stories. They're not anymore a piece of news. They're not خبر في الأخبار. They're actual people that you know their names, you know their families. You live with them. You eat with them. You round on them in the morning every day. So you get attached to them. So you have to have this emotional strength to go through this ordeal. Teamwork is very important there. As you said, as you saw in the way we assign roles and work in teamwork. Ethical practice, very, very important. Ethical practice, so taking consent, talking to the patient and detailing what happened during the surgery, and being honest with the patients, very, very important. Humility and servant leadership. We are not there to lead them, we are there to serve them. So wherever they ask us to be, we will be. Whatever they ask us to do, we will do. There's not a problem at all. I'm not going to say, oh, I'm this senior surgeon, how can you talk to me like this? La, 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 la. Okay, you want me to do this? Yes, I will do this. You want me to clean the room? we usually clean the room after we finish. You know, we help clean the room after we finish the surgeries. Communication in chaos, you know, and whenever there's chaos, there's a problem with communication. So you really have to be very clear and very calm when you deal with these situations. It doesn't serve you well if you yell and scream and shout at people during chaos. You just make chaos worse. You add chaos to the chaos. So you really have to have very good communication skills during the chaos and keep everybody calm, okay, in order to allow things to happen in a systematic way. And finally, empowering others, like what you saw with the medical students and the residents. So my conclusion is that we spent 5 weeks in Gaza. More than 150 surgeries were performed. More than 100 students were taught, and many lives were saved. However, we learned so many lessons in Gaza. One of the lessons is that the people of Gaza are amazing people, and they're very strong people, and we are just very blessed that we have met such people. I've worked in so many countries in my life, and I've met so many people from different countries in my life, but I've never ever met people like the people of Gaza. Thank you very much.
شكرا جزيلا دكتور هاني. الحقيقه تجربه يعني حياتيه اكثر من رائعه. الحقيقه كل اللي موجودين اتاثروا بيها جدا. البرزنتيشن بتاعتك يا هاني يعني وضحت كتير جدا من اللي الناس كان ممكن ما يبقاش حاسين بيه او شايفينه. اسمح لي ان انا انشر البرزنتيشن دي وورلد وايد عشان توصل رساله للي بيحصل في غزه، وازاي الناس دول استحملوا كل اللي حصل. وان كنت انت قدرت يا هاني تدخل، فكان في 2000 دكتور مصري مش عارفين يدخلوا من الحدود عشان يقدروا يساعدوا الناس جوه. فضلنا مستنيين بره. احنا اللي دخل مننا كان مجموعه صغيره، ودخلنا زي ما قلت لك كده من غير اوراق علشان البوليتيكال ايشوز. الباقي كله استنى في العريش وفي الشيخ زويد وفي رفح عشان استقبال المرضى الفلسطينيين اللي كانوا بيخرجوا. بس الحقيقه دول كانوا بيخرجوا بعد الاستابيليتي، يعني اتس نوت ان ذات emergency ان انت كنت بتقابلها جوه at the scene of accident and a lot of emergencies you are faced, you and your teams and your colleagues in غزة. ملحمة كبيرة جدا الحقيقة اللي حصلت، ويعني مهما حد تخيلها اللي شاف وعاش غير اللي سمع. لكن اللي انت نقلته يا هاني الحقيقة شهادة للتاريخ، ويعني انا بشكرك جدا عليها. كويس ان انت قدرت تاخد الصور اللي انت قدرت تاخدها. حتى الحاجات اللي احنا قدرنا ناخدها من خان يونس احنا مش عارفين نتصرف فيها، لان انت عارف التصرف في الحاجات دي ممكن يبقى مضر اكتر منه مفيد. لكن البرزنتيشن دي يعني اعتقد ان هي هتبقى لاند مارك لناس كتير جدا. وانا يعني I will try to be distributed all over the country, all over the world. And I have a lot of questions for you, but I will stand to my colleagues in Aswan and in Yemen and in Libya and in Saudi, who are following us on YouTube channel and on Zoom channel and Zoom app. If any one of them have any question, can you ask you?
Any questions?
الحقيقه الناس مش قادره تسال. يعني هو السيمباثي اللي انت عملته معاهم مش عارفين يعني غير ان هم يقولوا لك متشكرين جدا. و يعني كل الناس بتشكرك والله يا هاني. يعني هبعت لك اللينك بتاع اليوتيوب تشانل على الواتساب عشان يبقى موجود عندك. ولو في اي اسئله هبعتها لك برايفتلي بقى عشان ترد عليهم. لكن الحقيقه احنا متشكرين ليك جدا. اولا متشكرين ان انت كنت يعني اونلاين معاهم في كندا وبرضه استنيت وجيت كملت معانا، فده مجهود انا بشكرك عليه جدا. مبسوط جدا ان انا قابلتك تاني يا هاني حتى لو اونلاين مش فيزيكالي. يعني اتمنى نتقابل قريب،
ان
واعزمك
شاء الله.
قريب زي ما جيت المنصوره اعزمك تيجي اسوان. بس تيجي في
اتشرف
الوقت اللي
اتشرف.
فيه الجو كويس. اه والله. بس هتيجي في الوقت اللي فيه كويس، ولو ان انا عارف ان انت متعود على الحر. بس بس I think ان انت لو جيت في وقت في يناير في جون في January or February it will be better for you.
اتشرف
هعمل لك فسحه كويسه يعني لو انت جيت.
اتشرف بيك يا دكتور وبالاخوه والزملاء، وان شاء الله يكون في تعاون اكثر ان شاء الله.
الناس بيكتبوا لك
خلينا
الناس بيكتبوا لك يعني كلام لطيف كتير جدا. هاخده منه سكرين وابعته لك.
اشكرك.
لكن
وفي
دكتوره
سؤال
زهره
بقى
بتسالك اه wouldn't words not enough to be thank you. لكن دكتوره زهره دي استاذ مساعد جراحه في طب الازهر يا دكتور هاني. بتقول لك
اهلا
was
وسهلا.
the area you lived بتقول لك was the area you lived in Gaza protected enough.
Uh,
هو
so so when you enter Gaza, um, we entered with the United Nations. So they know exactly where you are going to go, um, and they know that this hospital has a delegation from the United Nations inside that hospital. So the rules are, they don't attack these hospitals, and they don't attack these cars when we move from one point to the other. These are the rules. But there has been attacks on United Nations cars before we go. They killed, they bombed 3 cars from the United Nations, the World Food Bank or something organization. They actually targeted the 3 cars. They were driving in a convoy of 4 cars. They bombed 3 cars, and 1 car ran away. So they tell you, the people that are driving the cars from the United Nations, they tell you we are going to move from this point to this point, but we have no guarantee that nobody will bomb us. So there are no guarantees, but there are agreements not to bomb the cars and not to bomb the hospitals that you are in.
but nobody is protected.
يعني بالاتفاقيات, with the agreement, we are supposed to be protected, but the question is that agreement always respected or not? So there is always a risk that they don't respect the agreement.
All of us knows this answer. شكرا جدا يا هاني، احنا سهرناك وانا عارف ان الوقت متاخر في عمان
لا عادي
دلوقتي.
عادي يا فندم. لا
اعتقد
عادي
الساعه احنا بعد نص الليل في عمان دلوقتي، مش كده؟
دلوقتي الساعة 2. ايوه بس عادي عادي، اذا في اي اسئلة انا
انا ليا سؤال بس في الاريا وانت شغال في المنطقه هناك. الليميتد ريسورسز اللي كنتوا شغالين بيها، ودي حاجه مهمه جدا عشان الناس تتعلمها. have to coopted with very low limited resource.
So very important to know what you have before you go to the surgery. ايش الاشياء الموجودة وايش الاشياء اللي مش موجودة، وبعدين you adjust accordingly. So for example, bowel anastomosis, there are no staplers, so you have to do hands-on anastomosis. Cautery, sometimes cautery does not work. Sometimes electricity goes off, so that you can't use cautery. And you can't stop the surgery, so you have to use other methods, like pressure, like suturing. in order to control the bleeding. Sterilization was an issue. They do have they do sterilize the equipment. I don't know how much percentage of sterilization is done, like and how clean they are, but they do sterilize the instruments. They just put them in Sidex or a solution, and then we use them for the next patient after like 10 minutes or 15 minutes being in the Sidex. In the south, the problem was less than the north. In north كان في مشاكل أكتر في equipment وفي sterilization because there is just they did not allow anything to go to the north. So there's very little equipment in the north. But you have to accommodate. So that's when your skills come into the picture. That's why I tell my residents إنه Allah subhanahu wa ta'ala أنعم علينا إن إحنا we are surgeons because you have skills to save lives. And in order for you to survive such an experience, you have to be very well trained as a surgeon. Unfortunately, you find a lot of surgeons cutting corners, and they think, oh, that's cute, that's smart, but that's not good actually. And that's what I tell my residents: don't ever cut corners as surgeons. You have to be very meticulous as a surgeon. With that, خلاص, your mind thinks in a different direction, not only in one direction. So you have a lot of options. So I think that helps a lot.
ودي رساله مهمه جدا ان الجراحين لازم يتعلموا كل البيزكس، ولازم يبقى في تريننج على البيزك سيرجيكال انترفنشن. ما نعتمدش دايما على التكنولوجي اونلي، لازم نعرف هاو تو ديل ويز ديفرنت تكنيكس، ويبقى عندنا مالتيبل سوليوشنز موجوده عشان تقدر تعمل تباديل وتوفيق مع اللي موجود قدامك، لان مش كل الاماكن هتبقى افيلابل فيها الرفاهيه ان انت تلاقي فيها كل اللي انت عايزه. حتى في اماكن ما فيهاش حرب، يعني حتى في الاماكن الفقيره نوعا ما مش هيبقى فيها كل التكنولوجيز الهائله اللي الناس بتستمتع بيها في المستشفيات الكبيره او في الاماكن الكبيره. والحقيقه ان الناس في الارياز دول بيبقوا محتاجين اللي بنقول عليه في المثل العربي يغزل بكعب حمار. لكن الحقيقه ان انا يعني مبهور بالبرزنتيشن وبالوقت اللي انت قضيته هناك وبالتجربه، لانها كانت تجربه ثريه جدا. هي برضه دكتوره زهره بتقول لحضرتك so in the war you just rely on clinical picture no investigation.
So we have investigations. So you will have X-rays. Sometimes they will come with CT scans done in another hospital. So they will come with a video of the CT scan in the phone, and then you have to go through the CT scan and then decide. So I am trained to read CT scans. So I read my own CT scan. I to read CT scan. And that's also what I advise all the residents. Read your own CT scan. Don't rely on the
Yes.
So they most of them will come with some kind of investigation, but not comments.
Yes. The dictum is don't treat an X-ray, don't treat a report. You are treating a patient. It's must the report and the X-ray and all investigation is correlated with your clinical picture and your clinical sense and your patient. If it is your clinical is different than this X-ray or report, you must repeat it or to take another method to depend on your clinical scenarios and in clinical sense, which is very superior to any investigation. Okay. هم الناس هنا بيشكروك جدا يا دكتور هاني، على وعد بقى ان احنا المره الجايه ان شاء الله في البرزنتيشن اللي جايه تكون محضر لنا حاجه بقى جديده نتكلم فيها برضو في الامرجنسيز، لان
so much.
الحقيقه الديسيجن ميكنج واحده من الحاجات المهمه جدا برضو، ان الديسيجن ميكنج في الامرجنسي از ديفرنت ذان ذا الكتيف. بيحتاج وقت قليل، بيحتاج خبرات عاليه جدا، بيحتاج كوبريشن بين الناس وبعضها عشان يقدروا ياخدوا القرار في وقت صغير خالص.
صحيح صحيح.
شكرا هاني، وسهرناك يا حبيبي، وان شاء الله ويتنج ان انا نتقابل فيزيكالي اور اونلاين اجين.
ان شاء الله حبيبي، ان شاء الله. شكرا جزيلا.
سي يو سون. تصبح
شكرا
على خير يا
لك.
حبيبي، السلام عليكم. مع
عليكم
السلامه.
السلام.
شكرا يا دكتوره زهره، تعبناكي معانا
شكرا.
وسهرناكي معانا، معلش.
مفيش أي حاجة. شكرا دكتورة هاني، نورتنا والله. ربنا
شكرا
يبارك في
دكتور
شغلك.
زهراء، الله يخليك،
مع السلامة.
شرفنا بيكم. شكرا.
مع الف سلامه، مع السلامه يا سلام.